Hey, John.
Okay, welcome everyone. Hey, it's great to have you on. We have a very special call planned for you today. We've got the famous Dr. Nicholas on the call. Dr. Nicholas is been a chiropractor, a leading chiropractor in the Arizona area for the last 20 plus years. He has been with Lifewave for the last 10 years and has an extensive knowledge on the technology, how to use it, and we are going to have a great opportunity to answer questions, to give you some real strong insights on the amazing power of the technology, Lifewave technology that's available to you. We're very excited to bring this to the European market and the rest of the world. And so what I'd like to do is I'm going to turn it over to Dr. Nicholas and have him just give his quick story of how he got introduced to it and what got him so convinced to become part of Lifewave. And then we're going to turn it over to John and we're going to have a question and answer sessions. And then hopefully we have a little bit of time to answer all of the questions for you. So Dr. Nicholas, great to have you. If you could just share your story quickly. These are
Sure.
most everyone on this call is relatively brand new to Lifewave. Okay. They've only started to experience the technology over the last couple weeks at the most. And so we're excited to have the opportunity to have you speak.
All right. Thanks a lot for having me. So yeah, it's an honor and a pleasure. Actually, I found Lifewave reading a book called Breakthrough, 8 Steps to Wellness. It was Suzanne Summers wrote the book, and she was interviewing different medical doctors on different non-pharmaceutical therapies, i.e. stem cell therapy, bioidentical hormones, different nutritional supplements on ways to help people with a lot of different diseases. Excuse me. So at the time, it was actually 12 years ago, last month. So my wife at the time was having a lot of health issues. So we were kind of desperately looking, and her symptoms were memory loss, heart issues, digestive issues, whole body pain issues, no energy issues. She was losing eyesight. It was really bad. It was kind of scary. It got to the point where you got desperate. And then she'd been in and out of the hospital multiple times for heart issues. And so we stumbled upon the patches in the second to the last chapter in the book. And it's Suzanne Summers interviewing David Schmidt and talking about how this technology was initially made for our military over 20 years ago. So it's not new, but it's a new concept to us then, and even now to some people, because again, it's light therapy. So we called Lifewave. The number was in the back of the book. Didn't know it was in a business. We just wanted to use the stuff. And so they said, well, we have to sign up under somebody. They put us in under somebody in Phoenix. We lived in Tucson at the time. And we got all the patches and I put them on her. And within 24 hours, like 90% of her problems were gone. And, so it was very dramatic. And, when you have something like that, that's life changing. That makes you go, okay, I really want to use this personally and I want to share it with the world. So everybody in our practice knew how sick she was. So they're like, what did you do? And I said, I don't know, but put these on and tell me what you feel. And one by one, we were getting all these dramatic healings. And so the word just it spread very fast. We got very, very involved in the company. And then we quit practice after 2 years of doing it part-time and went full-time. So I am since back in practice part-time, but I'd still do this full-time with Lifewave. And Jason keeps me very, very busy. So I love doing it. It's an honor and a pleasure. But yeah, this was 12 years ago now. And I mean, the product is just now like hitting a mass tipping point where it's more mainstream. Before it was kind of like a little odd, a little Band-Aid that has nothing in it that goes into your body, non-transdermal, that to a lot of people is kind of having a hard time wrapping their brain around. But the whole light concept is getting so much more attention these days, the whole energy medicine concept. And this is it in a patch. And to me, it's probably the most amazing product I've ever seen in my 22 years of practice. And I literally I call it mini miracles daily. It's just mind blowing. And every day I go, I don't know if this is going to work or not, but it's sure going to be interesting to see what happens. And more times than not, I see profound changes in front of my eyes. That's what really just drives me and motivates me to be here today and share this with you and help you guys get going where I am, So that's my story there.
All right. So, John, thank you very much, Dr. Nicholas. And really, the goal of this Zoom is to have a question and answer session. And I know many people have sent in questions and answers. So, John, I'm going to turn the call over to you. And if you want to basically interview Dr. Nicholas with the questions and answers, we can take it from there.
Yeah, thank you, Jason. And again, thanks for that introduction, Dr. Nicholas. Yeah, we've had quite a few questions come in at short notice, and we'll just see how many we can get through.
Okay.
And we'll work out how to get any others answered after this session. First one from Elaine in the UK. I'd like to know about, she experienced a headache when she first put on the X39, and she referred to it possibly being an exohymer effect. I'd like to know what to suggest to people to introduce it to if they get a headache, or possibly any short-term effects that aren't necessarily seen as positive. Can any of our products be used to help reduce severe pain and heavy bleeding, things like that? If so, which products and how do we use it? So maybe a lot of questions in that first one. I can go over it again, Nicholas, if you want.
Sure. Let me unpack that. Yeah, it's a lot. So first, your body can detox, okay, first and foremost. If it's too uncomfortable, you can take the patch off. It stops working. Your body typically goes back to where it was prior to putting it on within about 10 to 15 minutes. You can drink lots of water. That makes these things work a lot better. You can change the placements. I've had people say the placement made them uncomfortable for some reason. They put on the other placement and they said it felt fine. I've had some people say my head hurt right here and they put the patch right there and it made the pain go away. So you can experiment with placements. If it's too much detoxing for you, you can literally hold the patch in your hand like this, and it's turned on physically right now. And maybe I can only do it for an hour. And then tomorrow I'll put the same patch back on and do it for 2 hours and build it up in my system. And then usually within 2 to 3 days, they're fine. Even if they choose to leave it on, those symptoms usually subside in a couple of days. But it's not common. So I don't even like to tell people, okay, you may detox, because then you're putting it out there. I mean, it's like 1 out of 100 may feel some weird changes, but it's a sloughing off of old cells to new cells, because we're activating the stem cells. Your stem cells can get older. You have older cells. We're kind of like regenerating the body. And in that process, again, we're sloughing off old things, bringing in new things. And it's like kind of like the caterpillar turning into the butterfly, kind of like a growing pain kind of thing. So it's not uncommon, but it isn't something that most people have any kind of symptoms and that sort of thing. So now to get into, if we're talking about the other patches also, before X39 came out, my favorite patches were Icewave, Glutathione, and Eon. Those three combination were the pain management combination. They do a tremendous amount for pain relief, but also accelerated healing, because one's an anti-inflammatory, anti-stress. That's the Eon. Glutathione is the big detoxifier, but it also helps reduce inflammation. And the Icewave pain patches will increase circulation. Okay, so it will drop a temperature variation about 4 degrees within 5 minutes, which increases circulation, which is accelerating healing. That's why they're so dramatic for the most pain relieving demonstratable patches that we have. Okay, so that's the answers I have. Did I get all your questions in that, or where am I?
Yeah, and just on that one, Nicholas, so in a similar vein, somebody who has, say, recurring migraines, etc., would you still go for that trio of X39, Icewave, and Glutathione?
Okay, if it's a hormonal issue, the SP6 patch works dramatically well for this. You use them on the suggested placements first. Then there's also a point on the back of the left ear on the mastoid bone. You can put it there. It also is a hormone channel. This patch directly affects the hypothalamus, which is where your hormones are also regulated. If the hormones are out of balance, like women that are having hot flashes, or an increase in menstrual cycle bleeding, or awful headaches during the month of that time period, this patch will just almost eliminate it immediately putting it on. I really, really like that patch just specifically for that. I like using the glutathione neon as kind of that will complement it, or ice wave. So it's kind of like you have to experiment, because some people will get really good results with one combination and one with a different combination. And ultimately always X39 just for the true healing benefit. So I'm throwing at you kind of like a picture, and it's kind of like a good, better, best protocol where you can try different scenarios, because they don't fit each person specifically exact. It's not a one size fits all. So play around with that. But SP6 has really been the most beneficial with ice wave on the points that are headache points in the booklet. Okay.
Great, thank you, Nicholas. Question here from Jody. On the packaging, it says to wear the patch for up to 12 hours and then discard. Nowhere that she can see does it say not to put on consecutive patches. Is it bad to put on a new patch every 12 hours, or what's the science behind 12 hours with it on, 12 hours with it off?
Okay, so David, the inventor, David Schmidt, said that your body can actually acclimate to the frequencies. So if I'm wearing this patch for 24 hours, eventually my body may not recognize the frequency. So that's why he suggests an on-off period, so your body has time to, because when you turn the stem cells on by activating them, even though you take the patch off, they're still actually working. Okay, it's like starting your car, now it's running. Okay, so I personally use the patch for 12 hours, and then I use a different patch for 12 hours. So I'm constantly getting the healing signaling of different wavelengths of light, because each patch is emitting a different wavelength of light. The length of the light determines what it is, i.e. why there's different patches. So I wear a certain combination during the day and then a certain combination at night. And some people reuse the same patch. Okay, so some people use an old one and a new one, or some people just use a brand new one. I personally use them for so long, I kind of feel like I think they last about 24 hours. So I personally use it more than one time. So I only take one half of the adhesive off for a 1 day use, and the next day the other half off for the second day use. Does that make sense? Are you clear?
Yeah, that's a very interesting concept to a lot of us. So you're saying that you wouldn't necessarily take both sides of the peel off to use it for 2 12-hour sessions.
Correct. And the whole patch is actually working. It's just you're saving the fresh adhesive side for the following use. And if it falls off, then use some tape or a Band-Aid to keep it on.
Yeah, but what you're saying in effect, Nicholas, is that if we're talking about just specifically one patch, i.e. X39, it is literally 12 hours on, 12 hours off. And if you're using another patch, that's fine to use it in the remaining 12 hours, but not the same patch for 24 hours.
Correct.
Yep, great. Okay, no, excellent. Question here from Elaine again. Any advice on what to say to people who don't notice any difference after trying the patches for 5 or 10 days? What is the minimum period that we should suggest they should use it to give it a proper trial?
I really, really stress this, because a lot of people, you don't want to, you want to undersell it and let it over deliver and have people kind of like write down all their symptoms and problems, because sometimes the things you want to be gone aren't, and some of the things you didn't expect are. And so there's a process of, I say 30 days minimum to give it a fair try. And then I give them sometimes an experience is trying one patch for an experience, just to see what it looks like, feels like. Some people notice some changes, some don't. But to actually really give it a fair try, I mean, literally 30, 60, 90 days. And there are profound pictures floating around. I literally had a call last Wednesday, a lady, 76 years old. She has neuropathy in her feet, and it's just been severe. And she stuck it out for 4 months because she didn't know what else to do. And in 4 months, it's completely gone. What if she'd have stopped at 3, or, so she just felt like I don't have any other choice. I don't have any money to do other things. So I'm going to just keep trying. And inevitably it gets to what you want. It just, some people are faster than others. And so when you don't feel anything, it doesn't mean it's not working. It just means that the stem cells are all turned on and they're working systemically, and they're going to go to the biggest, most life-threatening situation in your body. So you're not going to die of back pain or knee pain. But let's say you have something going on with your heart or your brain, but you don't feel that. So a lot of diseases are very asymptomatic. And so those stem cells are going to put out the fires of those issues that you don't feel. And then eventually it goes to the areas that you go, wow, my knee's starting to feel better. It took 3 months, or it took 2 months, or 1 month, or 1 week, and that's how it works. So if you have a situation, you're dealing with a problem, like your knee hurts, you can put the patch right on the knee. It doesn't have to go on the suggested placements. For symptom relieving use, I have people do that. I've had people use 2 patches, meaning like one on each knee, because they had bilateral knee pain and they were only using X39, and they said it worked great. So that's the thing about experimenting, but technically one's fine. But if you're really in pain or symptomatic and you're only using X39, try 2. Okay.
Great. And just while we're on that topic, I know I've got a question from Emma coming up next, but it's very relevant to something I wanted to ask you, because Emma's asked, other than maybe cost benefit, how does a stem therapy injection differ to the patches? Now, just before we move off that last point, Nicholas, I wanted to ask your advice, because obviously we're newbies and we're looking at how to reach the maximum number of customers and not let any fall through the cracks of maybe on the promises of a 1 day, a 5 day breakthrough that they have. Because again, like yourself, we witness that everybody's different and they all have their unique timelines. So as an overall umbrella positioning message, would we be almost safe to go out with a 90-day stem cell challenge to see what could happen in 90 days, given the cost of stem cell injections, etc. We have a safe, natural alternative, nature-inspired technology. Is that a safe positioning statement to get most amount of results for people, and not maybe go in on the sudden, wonder result in a few days?
Right. I think that's the wisest choice. And this is where, if you're signing them up as a distributor, the $300 silver kit technically gives them 3 months worth. That way they're giving a serious fair trial, cost effective and everything like that. So that's where a lot of people have been signing up people as silvers. Okay. But yeah, so the difference between this and the injection. So that's a great question. So the injections, it depends on what stem cells you're using, whether it be the bone marrow stem cells or the fat adipose stem cells or the stem cells from the umbilical cord. I mean, this is where it gets more and more controversial, more and more expensive. But again, you're injecting them into an area to fix the area, where the patch works systemically. My whole body right now is having a healing effect. And as I continue wearing this, it's going to continue doing healing every day. An injection doesn't do that. It's a one-time shot. And so what this does is, if you did both, it actually can enhance the quality and also the integrity and structure of the stem cell injections, because this is elevating this peptide that we already have in our body, but we have less of it, hence why we have less stem cells and stem cell activity. So if we have more of the GHK copper peptide, the injections are actually going to do even better. Okay. So, but I've had people try the injections, it didn't work, and they tried the patch and it worked. Okay. So it's because it's your own body doing it. This is what I love about it. Okay. So this is for the masses that can't afford the injections, and the people who can't afford the injections may want to increase the clinical outcomes of the injections. This will do it by a lot, almost more guaranteed. I've seen it. So it's pretty cool.
Fantastic, thank you. So Emma's asked another question here. Somebody who's been told that their hair follicles are dead, they'll no longer produce any hair. We've obviously seen before and after, exciting images of how X39 has helped with balding or thinning hair. In the same vein, could it help with reawakening the hair follicles?
Technically, it's supposed to. That's what, if you research, just Google or look up on the Wikipedia, GHK-CU, and it'll give you like sections of all the benefits. It's fascinating how many things it does beyond just the stem cells and all the things that it truly helps. And for me, I hand that to people and say, here, please just read this. And then they can see all the other health benefits. Yeah, technically it's supposed to, because it's literally showing we're regenerating our body. We're healing our body. We're reversing the age of the body. So in a sense, yeah, it's supposed to, but we just don't know yet because it hasn't been out long enough, but you're already starting to see some, i.e. before and after pictures showing people are getting those changes.
And you mentioned there, Nicholas, the GHK-CU, which again, apart from the excitement and all the science behind stem cell injections and therapy, over your many years experience with this, well, certainly with X39, it's only in the last couple of years or so, but would you confidently direct people who really want to dig into the science, because there seems to be ample behind GHK-CU itself. So, you know, not only are people warmed up to the idea of, you know, the amazing attributes of stem cell therapy, but would it be correct for some people to direct people to look at GHK-CU research? And if so, have you ever used any preferred links to do that, just to validate what we're doing here?
Yeah, I mean, so like we're all marketing to people. So I started out talking about affordable stem cell activation, and the lady asked me how does it do it, and I told her it elevates this peptide GHK copper, and that was, she already knew all about it, and she's used it for a skincare serum for her skin, which is why she jumped right on board. So yes, I suggested, I even talked to a lot of doctors and I say, do you guys know anything about GHK copper CU? And they said no. And I have them read the article from the Wikipedia, and they're like shocked at all the health benefits. So they're very, very intrigued by it. So it's not new, but it is new to quite a few people. So that's a really good, if people will look at it, yes, it's a great way to get them educated. Because then we have a study by Dr. Melinda Connor that actually shows by blood saliva tests, or actually blood serum tests, that we're elevating the peptide through a blood test. So we can prove it. And then we have all the references saying, here are all the benefits, what you're just talking about. So that way, if they want that, it backs it up and just say, okay, now try it for 90 days and see what happens.
Yeah, fantastic. Elaine has asked another question, which I think you may have answered, Nicholas. She's saying basically, if someone has multiple symptoms and is very sick, would the X39 somehow be too much for them? But I think you referred to your own personal experience right at the get-go, where your wife had a number of issues. Would your answer be to that, it's worth a try?
Everybody, yeah. I mean, when in doubt, always patch. I mean, I've been doing this for so long, and I've had distributors and people that I've talked to over the years, and they just get so kind of used to the patches, and they don't think, well, I don't think it would help with this or that. I said, always try the patch for anything before you do anything else, because more times than not, it will do some amazing things, and you just don't think it would. So I always tell people, always patch for everything, and just see. You know, it's the most least expensive, non-invasive thing you can do, that you don't have to go to a doctor or a therapist first to try to see if it will help you. And you'll be surprised, really surprised.
And I guess it keeps us in that safe ground of saying, I can't promise you anything, but it's worth. So in other words, making claims and promises, which we never want to do, and we never can do anyway with any real confidence, because we just don't know the timelines involved. The next two are sort of morph into each other, Nicholas. From Elaine, we know someone who's recently had an eye operation and put a stent in it for a condition. Would it be okay to use the X39, or would it cause the body to reject the stent? And then it sort of leads into a question from Emma, which is, I've heard that you cannot use the X39 if you've had an organ transplant, etc. So are there any conditions Nicholas, that crop up that you would say do not use the X39 if this is being experienced?
Yeah, you kind of have to just cover your butt by always saying, always ask your medical doctor. You know what I mean? Yes, we don't know because there's not been studies done, but we assume, okay, this is enhancing and supporting the immune system. Where when you do an organ transplant, the medications suppress the immune system so it doesn't reject the organ. That's the philosophy why they're thinking probably shouldn't. I've actually had a gentleman use it anyway because he wanted to use it and he had no problems. So, the other contraindication is if you're doing chemotherapy or any disease such as cancer, that they don't want you to use it during that time frame because, again, it's suppressing, killing off, blah blah blah. This is going to support, increase, and also help to regenerate the body. So you may do it before or after it. So, yeah, if you have an eye issue, put it over the eye. I mean, I've had people use a sleep mask and apply it over the eye, and it activates 3 to 6 inches off the body. So this is fully activated, okay? Because there's that field of energy coming off the body. So if it's the right eye, put it over the eye when you sleep. Before X39, we were using glutathione and carnosine for pretty much every eye condition, and it was doing amazing things. Amazing, okay? So X39 is doing a lot of great stuff too. I had a guy, a medical doctor, literally had a patient up in Canada, and she was telling how wonderful she was doing and all the things. So he goes, well, I want to see the labs. That tells me if it's really working. And he did her lab work and it was significantly better. So he wanted to try it. I mean, as soon as he held the patch, he said, I could see better. He was freaking out. I mean, this is how fast it works systemically and why it was his eyes. We don't really understand it, but we just know that it's immediately activating things. Things are happening on instantaneous. Like when you turn a light on, the light's on instantaneously. That's electricity. This works on that same concept. So that's why it just seemed to make a difference in his eyesight immediately. And he said it's been improved since.
Fantastic. Yeah, I think that's another to the rookies on this presentation. Apart from the peeling off just one part of the patch to use it, for the second 12 hours, etc., and also being able to hold the patch and to experience benefits without obviously peeling off the paper cover, etc. That people can experience that. They're really fascinating insights. So a quick run on some final questions from Giselle. I think the first one you've sort of answered said, would you recommend a person wearing the patch on day 2 for an additional 12 hours? I think you've covered that. She's saying for a few days she was unable to fall asleep. She says, I go to bed around midnight, have my takeoff to 8 p.m. irrespective. Okay, that's not really clear enough. Sorry for not a clear enough question. I've had for the past month problem with my middle finger not bending and straightening as normal. Would you recommend another patch, e.g. Eon in addition or on its own to X39?
Yeah, I mean, look, when in doubt, for me personally, because I understand and use all the patches, always Eon, glutathione, and X39 for pretty much any inflammatory issue. That covers everything. Okay, and if your finger can't move, wrap the patch around the finger, see if it can move better. That's how I do that kind of stuff. I mean, keep it very simple. Again, it's all about duplication. So you can tell more people and more people can do it, and don't feel like they have to have somebody do what I'm doing right now. So yes, when in doubt, patch it. Eon is great for that. Usually it takes the tension out. Carnosine's another patch. It's a regenerating patch. It regenerates tissue, muscle tissue, heart tissue, cell tissue. It's kind of like the lonely stepchild of the YH patches, but it is a very, very good patch. David did a big talk with the X39 and carnosine, how they really work together. And he has it was done about a month ago. So that video is floating around. I think it's in the back office under the YouTube channel for Lifewave if you want to watch that. But he does give a very good explanation of how carnosine works as well.
Yeah, thank you. Just oh yeah, so you may have touched on this already, Nicholas, but who cannot use X39 or other patches? Could you just reiterate anyone who should obviously talk to their medical doctor, their MD, etc., but before using any of the products, if concerned, but any really standout situations where people should say, let's hold off?
No, I patched babies, moms, pregnant moms, dogs, cats, horses, you name it. I patched it. There's no side effects. This product's over the counter. It's non-transdermal, no chemical, no drug, nothing goes into the bloodstream. The reason why they always say you don't patch someone under the age of 18 is because they haven't done studies on that. So they technically have to legally say that, but they're completely safe. Okay. And the only contraindication again was somebody that's doing chemo or possibly an organ transplant. But other than that, none. I've patched everything.
Yes, and on the same vein, I presume Giselle has also said, can an ice wave patch be worn, for childbirth? Can it be used? Can X39 be used immediately after a cesarean or pregnancy, etc.?
Absolutely.
Yeah.
Absolutely. I have plenty of moms in the practice that are, having pains, growing pains. They come in for an adjustment. I still patch them all the time, and they totally love it because it just supports the adjustment. Some moms are concerned about, like when they do the glutathione or the X39, oh, I'm going to detox. I'm like, well, that's good. It's better out than in. And then they go, well, if I'm nursing, I said, well, the baby's going to get clean milk too, right? It's not toxicity because it's going out of them. So that's i.e. why I say it's okay to patch the baby or the mom. The mom's clean. If I'm wearing this patch and you come up and touch my hand, you're getting the patch benefit. Do you understand that? Because there's a body-body connection immediately makes the patch work to that person touching you. So that's why it's still going to make a benefit to the baby.
Yeah, wonderful. Thank you. And again, just a couple of final questions, and we're nearly done on that. Can X39 help with, say, autoimmune skin issues?
Yes. So before X39 came out, Eon and glutathione were my go-to patches for that. X39 has only been out for so long. So like a lot of conditions, I haven't used it for those because I've had so many already positive benefits before it. So I haven't seen people come in with it. But ultimately, yes, I had a lady, she's got severe RA, and she'd been using all the patches and it got it really under control. And I think X39 just, like, she did lab work and it shows she doesn't even have it anymore.
Great. And in terms of helping regulate blood sugar, have any of the patches that you've worked with, any noticeable improvements there?
X39 dramatically. Before X39 was carnosine and SP6. SP6 helps with stopping cravings. So it's a craving killing patch. But the real patch that really seemed to make a pretty significant change was carnosine, but now X39 has been dramatic. But again, it talks about it on that Wikipedia explanation. That's why I suggest people looking at it, because it will kind of get into it and why it's doing it. So it's the benefit of this elevation of this peptide seems to have a dramatic effect on very specific conditions you're asking me about, but it will explain it in that article.
Fantastic. And just, I know one question came in just recently, just in terms of, I think one of the products called is it Nirvana, in terms of mood enhancement. Have you had much feedback on that one, Nicholas?
Yeah, I mean, it's clinically proven to help with mild depression. So if I've never tried it. It's still a big seller. They kept it around. They kind of went through about 2 years ago and got some of the patches out that just weren't really moving or doing anything. And this thing, it's got a very unique market and it works. We've had people even use it and said it helped them with their pain because they felt so much happier. So it just brought them out of that funk. So yes, it's and I'm told you don't have to use the nutritional pill. From my understanding was the pill is basically made up of 3 specific ingredients. that I can't think of off the top of my head, but it's all natural. And it just helps to make you feel a little more happy, and enhancement of your mood. And the patch was supposed to amplify it. That's why it works so well together. So I don't know for sure, but they say you don't have to use the pill with the patch, and people are getting the same good results. So that's all I've heard.
One of the questions that's popped up, Nicholas, in the chat section, relevant to some of the men in the audience, does X39 help boost testosterone production?
Yeah, I know. So they haven't done any studies on it, so we don't know for sure. We just know that the people have reported back they're sleeping really deep. They're noticing that they have more energy, they are stronger, but there haven't been actual like lab tests to prove it. David was saying in the very, very, very beginning, he doesn't say it much anymore, or hasn't. I haven't heard it in a while, but he was saying doing a shot of heavy whipping cream, or not heavy whipping, heavy cream, and then also like 3 or 4 of Brazil nuts would enhance the effects of this patch. So it may be on some of the very early videos, and that was having an effect on people's testosterone somehow. So again, I don't know the mechanisms or the nutrients behind what it was doing, but that's what he was telling people, and they were getting more of a response by using the patch. He essentially started to saying, okay, you can take a copper supplement, but again, it wasn't going into anything with testosterone. So I know David is working on things and trying to figure out all the benefits of this thing. So they have to do very specific tests to figure that out, but they haven't done it yet to see if it is or not for sure.
Great. And just a couple of final points on the chat messages there. Somebody's asked, Esther's asked, do you have to use the patch for life? I presume I'm right in assuming that that because it basically optimizes your stem cell activity. I guess certainly for me personally, I could never think of a day when I wouldn't use it. But
Yeah.
speaking, what is the answer to that?
Okay, so I get patients asking me this all the time, and I say it's kind of a personal preference. It's like, what are your priorities? If you want to get out of the symptoms you're dealing with, or heal whatever you want to have healed, and you're comfortable with that, you can stop. Sure. So when the patch first came out, David honestly didn't think it was going to work on anybody over 70, because after age 70, you don't have any stem cells left. So again, looking up under the Wikipedia, it explains by elevating this peptide, it actually takes a skin cell and reverses it back into a stem cell. You get that? So people are having results that are over 70, 80, 90 years old wearing the patch. And so that's the only thing they can think of. That's actually why it's working on them. Because technically you can't activate a stem cell if there's none there. Okay. So the benefits are continuing even over age 70 is what we're seeing. So it's a personal preference. I'm doing so many things health-wise that I feel like I can't afford not to. So that's the answer I give to people. And I feel like I'm saving money because I'm not using the healthcare system. I'm not using certain things that I used to use because my body's doing it now. So it's just like, you just have to weigh out the priorities of what are your priorities, and what do you think,
Yeah, no, great. And just on a personal question, I've been obviously wearing the technology for probably 6-7 weeks or so. Like Rory, our good friend, we're fascinated with any results with hair. I'm 65, so I'm questioning how much hope is left for me. But I don't know if I'm imagining it, but I'm looking at my hair and I can swear that the roots are getting darker. I mean, have you seen much happen in terms of, reversal in color?
Yes. Period.
I can live with it. Yes, that's great. Right. So just in wrapping up, firstly, I noticed that where you sign in, Dr. Nicholas, you've put your email, and that feels like you're opening yourself up to people sending emails to you. I don't want to drop you in it, but
Okay.
how do you, are you as a resource? Obviously, it's so exciting to have you with all this experience to such a group of rookies here that are excited about the potential and the future. And we would love to get you back on, with an even bigger group. I know in the next month. But can we email you, or what's the protocol for reconnecting?
Yeah.
Or should we
So
out?
we have an email list. You're welcome to get on, and you can just email Dr. Joan 9, so DRJOAN 9, the number 9, at Gmail, and request to be put on our email list to have access to us via protocols, what we send out, or we do a call once a week that I'm going to get on in here in about 15 minutes. They're recorded, and then you can take them and re-listen to them or share them. I have a YouTube channel, and it's just my name, Nicholas Tivoli DC, no periods, no commas. So Nicholas Tivoli, Tivoli DC. And I have very, very short videos to show you very specific ways to use the patches for specific things. So you can kind of get your hand on how to do it. And if you don't have access to me, what do you do? So I want to keep it, again, it's got to be duplicatable, how we can get this out to the masses and keep it very simple. And yeah, I've been working with Jason a lot, so we can try to arrange some things again and, do this again in the future. But yeah, so those are the things right now that I like for people to try to use. So then we can help and answer in any way we can. So
yeah, brilliant. So somebody's asked, you read my mind, Peter. Thank you for typing that in. So just to repeat that, to get on that email list, Nicholas, it's DR for Dr. JON.
JOAN, Joan.
JOAN
9,
number
9 at Gmail. And just say, I would like to be on your email list. And we'll send you a link that's for constant contact. And you click on the link, and then you pick what you want to be on. Because there's different categories. So we don't want to send you something you're not interested in.
Yeah.
And it's not a lot, but it's just some things to, and then that's the email you would actually respond to, or say, hey, I have a question, just shoot an email that way and we'll get to it as fast as we can.
Yeah, thank you. And Jodie's kindly typed that in the chat box if anybody wants to get that as well. And just in closing, Nicholas, this has been truly superb call. We all appreciate it here in mostly in the EU. But just to close, you've obviously you've been in this space for what, 10 years or so. You've been exposed to a lot in this time. If you look at it, pre X39 and post X39, could you give a perspective to the newbies here of what you've seen and where you see this evolving to? Because I know that David Smith has many more exciting projects on the drawing board that could be classed as wow. But where do you see it for a message for the people here who are just embarking on this new journey?
I think you're at the right place at the right time. Okay. So when I found Lifewave 12 years ago, I was blown away about how it worked, and it worked, and then how no one knew about it. So I'm like, this is the craziest, coolest thing I've ever seen, So yeah, let's share it and let's scream it from the top of the rooftops. Well, not everybody's open to the therapy. That's okay. So there was a tipping point happening. And 2 years ago, the tip happened because stem cell therapy is like the hottest thing in medicine, alternative medicine, pre-COVID. Okay. So it's an easy thing to talk about. So I ask a lot of people, are you familiar with stem cell therapy? And everybody's like, oh yeah, I already tried it. Or, oh yeah, I just went to a seminar on it. Or, oh yeah, my family member's trying it. I'm going, wow. So it's like the marketing part's been done. So I say, well, have you heard of this therapy? It's an alternative therapy that activates your own stem cells. And everybody's like, no, how much? That's the first question. And I tell them that they can't believe it's so cheap. And I say it's inexpensive. I said it's a very inexpensive therapy for the masses. And the masses are open, they're looking, and they're interested. So this is why the company grew 4 times over that year. I was the #9 earner last year. It's insane. I mean, I never done this before. I don't know how to do the marketing part. Jason's like the rock star. I'm so happy to work with because I'm learning so much. But this is the thing. It's like you're in the right place at the right time. And what David's coming up with is even more exciting than this. This is where it's just so bizarre exciting. If you want to be in something that's really truly big, bigger than yourself, you're in the right place, in the right company, and the right product. That's all I can say. Very exciting.
Nicholas, thank you so much. Jason, I'll hand back to you.
Well, thank you very much, John, and thank you very much, Dr. Nicholas. We greatly value your time, and we appreciate all your efforts. And team, we bring Dr. Nicholas as a resource and a wealth of knowledge to help you raise your belief level in this technology. And we are very excited to have you part of our team. And as Dr. Nicholas says, you are in the right place at the right time. So Dr. Nicholas, thank you again. I greatly appreciate your time. And I'm going to unmute everyone, and everybody could say goodbye. All right. Let me just see if I hit that unmute button. And all right, everybody, thank you for a great call. That was outstanding.
Thank you.
Thank you.
Thank you too. Thank you so much.
Thank you, John.
Thank you.
All right.
London, UK in the house.
All right. Well, this has been fantastic. Now, team, we do have a call tomorrow for our business opportunity Zoom. And John, is at 7 p.m. UK time, right?
Yep, 7 p.m.
Yes.
7 p.m. UK time. So please invite everybody to that call. We have tremendous momentum and excitement building in the UK. So we are very excited about that. And this is posted on our Facebook team, Stem Cells for Life. So you can share that to anybody that's a member, which you all should be on that. So that would be great. And you can share that with your other teammates that were not able to attend this call. All right. And we'll get the recording out to you also and get that posted for everybody.
Thank
right,
you.
everybody.
Thank you. Yeah.
Thanks, everybody. Have a great day. Thank you.
Thank you.
Bye.
Bye now.
Bye. Thanks.